year as Man of the Year and said, "Leaders make things possible."
We just had I think, a natural chemistry. Years ago, actually, it was a funny story. We were doing...
And 9 days to change the world. How about another round of applause?
I'm so fortunate to be able to work with the speaker because he gets it.
You know, it took us about 20 years to get into this problem. Unfortunately, it's not going to take us overnight to get out of it. It's a very complex problem. We think we're beginning to change with our prescribing guideline last year. Clinicians, medical schools, pharmacists, they're really stepping up to change the way they deliver care. We want consumers to also start thinking about this, not after they lost a family member, not after someone very close to them has had the harm of addiction, but early on when they're having that talk with their primary care doctor. Is that drug really needed? Are there safer ways to take care of my problem?
Introductions are out of the way. We're going to move on into the questions. And gentlemen, my first...
The problem is, and what we need to do.
The opioid epidemic is one of the few things that's getting worse instead of better. We have rising rates of deaths from overdose, while cancer and heart disease and so many other big diseases are getting better. So this is a crisis for the country. We know that overprescribing of opioids for pain is part of the problem. As doctors, we thought they were safe, we thought they were not addictive, but it turns out that for some people, just beginning a painkiller, a strong painkiller, can start a person on the road towards addiction or overdose or death. So we think it's really important for clinicians to change their practice and for consumers to start to know the risks involved. That's why CDC is working on getting a communication campaign launched so that people in these hard-hitting states will be able to think twice before starting an opioid painkiller.
With the opioid addiction problem at the level of intensity